I'm Dr. Rohini Paul. This is from Nursing Skill Tip. So today I want to talk to you about pulse checking, especially from the radial artery. That is what I'm going to focus today. So there are first level as nurses, I want you to remember this thumb. Three aspects of concentrating on the thumb. One is the radial artery which lies along the thumb, which we forget. Remember that. The second one, never use a single thumb to check the radial artery. The reason is your own pulsation is happening in the thumb, so you will mistake it with the patient. 2. The third where thumb, I talk about 3-finger pulse checking. In that, never add your thumb. This is 3 areas. So now, what is pulsation? Pulsation is when the heart is in a pumping phase. It's ejecting 30 ml of blood, which is coming through the systemic circulation, where in certain area we can palpate the pumping of the blood in the artery. So one is through radial artery. So that is what. So how do you check it? So 3-finger method. For 3-finger, don't use like this and do it. It's wrong. You need to little bend it. Then only you get an alignment bringing all the 3 fingers together. Then you just keep it right on the radial bone is your right radial artery lies. Don't press it too hard. So just palpate it. Feel the beat for 1 or 2 seconds before you start counting. So feel the beat. So this finger is towards the heart. We call it proximal. This is away from the heart. We call it distal. And middle, of course, is the right one will be palpating. So feel it and start counting it exactly for 1 minute. So what is that you are going to see? First thing is the rate. That is what? 1 minute. How many times you see the feeling of the pulse in your tip of these 3 fingers. That is what is called the rate. 1, 2, 3, 4. That is rate. Then rhythm, musical rhythm. Rhythm is always like this. So where every time the pulsation, what I feel, is it the same rhythm it is coming and touching my tip of my finger? That is rhythm. The third one, volume. Volume is like a patient is very feeble, collapsed. You won't find the amount of blood which is coming to the wall where you feel. It will not be the same from the normal human being. That is called the volume. So there are so many things as a nurse. If you could remember rate, rhythm, volume when you are checking, and check it for 1 full minute. And then when you document, you make it the normal adult heart rate is 72 to 80 per minute. That is what we should record. So hope you understood. All the best.